Hello, and thank you for watching Health Matters. My name is Ray Wall with Alberta Health Services, and today we're speaking with Kimberly Brooks, a registered dietitian with Community Nutrition. And Kimberly's going to give us some suggestions on eating well for cancer prevention. Hello, Kimberly.
Hi, Ray.
So what are some of the things that we can do to help lower our chances of getting cancer?
So eating well is one thing we can do to help reduce our risk of cancer. And healthy eating along with physical activity can also help achieve and maintain a healthy weight. And that can be one of the most important things to reduce our cancer risk. So research shows that 35% of cancers can be prevented by eating well, being active, and achieving and maintaining a healthy body weight.
What should we be doing to eat well?
So eating well starts with having a variety of foods, and following Canada's food guide is a good place to start. So we know that most Canadians aren't eating enough vegetables and fruit, but a diet high in vegetables and fruit can reduce a number of cancers. So trying to increase your intake of non-starchy vegetables and fruit to at least 5 servings a day. Now it's easier than you think. You can start with having a serving of fruit at breakfast and then 2 servings of vegetables and fruit at lunch and supper. Now a serving would be about half a cup of fresh frozen fruits or vegetables, or about a cup of green leafy vegetables like spinach or romaine lettuce, or a piece of fruit about the size of a tennis ball. So if you're having a larger piece of fruit, you can count it as 2 servings. You also want to make sure you're choosing a lot of variety in colors. So looking for your oranges, your greens, your reds, yellows, whites, and purples are all great choices. So some examples of those might be your butternut squash, your broccoli, oranges, green, red, and yellow peppers, spinach and romaine, and berries.
And are there other foods that we should also be eating more of?
Yeah, you want to try and increase your intake of whole grains and legumes such as beans and lentils. These are higher in fiber, and a diet high in fiber may reduce your risk of colorectal cancer. So ways you can increase your fiber is when you're grocery shopping looking for cereals that have 4 to 6 grams of fiber per serving. Choose foods that have whole grains in their ingredient list. If cooking dried peas and beans takes too long, you could also try the canned varieties. You can add chickpeas, lentils, or other beans to salads, soups, and casseroles, or even try a hummus dip with whole grain crackers and fresh vegetables.
That sounds really great. Do you have any other healthy eating tips for cancer prevention?
Well, another thing you could do is follow a lower fat diet. So choose lower fat foods and limit or avoid high fat convenience foods. Also, when you're adding fats to your diet, make sure you're choosing the healthy options. So looking at non-hydrogenated margarines, canola, and olive oil. The other thing you can do is reduce your sodium and sugar intake. So when you're shopping, look for low or sodium reduced options at the grocery store and avoid adding extra salt to your foods when you're cooking. For sugar-sweetened beverages, opt for more of your waters, your milks, and your unsweetened juices, and try and avoid your pops and other beverages like that.
Okay, thanks for the advice and all the information, Kimberly.
Thanks.
And thank you for watching Health Matters.